Hi, I'm Dr. Mishock. I'm a licensed physical therapist and chiropractor. What we're working on today is plantar fasciitis. So typically with plantar fasciitis, what happens is there's usually a flat foot that leads to increased stress through the plantar fascia. And the plantar fascia basically extends from the calcaneus, which is in here, all the way to the balls of the feet here. So what I'm going to use is instrument-assisted technique. Graston technique or gua sha is another technique that's very similar to this. What we're going to do is we're going to work gently over the tissues that are involved with the plantar fasciitis. So it's basically a scraping technique. And the idea with this is what it's going to do, it's going to, one, is desensitize the nerve endings in the area. So if you think of like a sunburn, for example, a sunburn is hypersensitive tissue. This actually helps to decrease that sensitivity, decreasing pain. The second thing I'm going to do with this here is I'm going to actually move the toes with this. So as I move the toes, that's going to actually increase the stretch of the plantar fascia. So we'd generally work this for about 30 seconds to 2 minutes. And the tools, actually, the reason we use the tools help to give you a better sense of the tissue. So whenever there's dysfunctional tissue, you will fill that through the tools. And this, of course, is before we would do any treatments, we do a thorough exam and assessment to determine what the dysfunctional areas are. We would basically work through all the plantar fascia through here. And we'd actually work up through the calcaneus too as well, because the plantar fascia has some attachments through the calcaneus as well. And we'd hit all those areas that are dysfunctional. We'd also look at the calf muscles too as well, and I like to use what's called fascial manipulation too as well. So a lot of times the calf, the gastroc-soleus complex, becomes tight, and it also can lend to the plantar fascia. So basically what I'll be doing here is looking for points that are sensitive. I feel basically a densified tissue. They're also known as motor points. But many times if we work the area of the calf, it'll help to relieve the pain in the heel or in the plantar fascia. A lot of people will sometimes develop Achilles tendonitis as well. We do a similar technique through the Achilles tendon. The Achilles tendon inserts on the calcaneus and it forms the gastroc-soleus complex, which goes up above the knee here. So this whole area can be involved. People will typically get pain around the insertion point of the calcaneus and into the Achilles tendon. What we do with this is we use, again, instrument-assisted, either Graston or gua sha. We work the tendon and the dysfunctional areas of that tendon. And again, what we'll feel is we'll feel the tissue differences, a roughening of the tissue when there's an issue with that specific tendon. And I like to use active motion too as well with this. So we'll take it plantar flexing and dorsiflexing the foot, working that whole area. And then after we do this technique, I like to go up into the calf and look for those points, trigger points, motor points, those areas of dysfunctional tissue through the calf. And then what we'll do is when we find a point, a motor point, we'll end up using our fingers, pads of our hands, or the elbows, working that area. And we'll work the area for about 2 minutes to about 4 minutes in a given area. Now these techniques are followed by the traditional physical therapy, which would include flexibility, strengthening, balance exercises, and a home exercise program that they could do on their own. And that completes the treatment for the Achilles tendonitis and the plantar fasciitis.